So today we're going to be talking about shock and the various different types of shocks. So what is shock? So shock is a lack of tissue perfusion, it's a lack of blood flow, rich oxygen, and buildup of waste in the body. And there's different subcategories of shock. There's cardiogenic, distributive, hypovolemic shock, and obstructive shock. So I'm just going to briefly go over all of these and then just focus on one specific shock. So we have obstructive shock. So it's a physical blockage within the body that prevents the flow of blood from going in and out of the heart. There is poor cardiac output due to process impairing the heart's cardiac rhythm. And some examples of physical blocks of obstructive shock, it's going to be cardiac tamponade. So it's a fluid buildup in the sac around the heart, and it's compressing the heart chambers. We have a pulmonary embolism, so it's a blood clot in the lungs that block flow through pulmonary arteries. And we also have a pneumothorax, and it builds high blood pressure in chest due to lung injury. So obstructive shock, so it's a mechanical obstruction that prevents heart from filling properly or pumping enough blood through the cardiovascular system. And if there's not enough blood pumped, so the amount of oxygen of blood then reaches the tissue is low, then we have acute hypoperfusion and tissue hypoxia. We also have cardiogenic shock, so it's trauma to the heart that results in not enough oxygen being pumped into the tissues. So an example of trauma, it's going to be a heart attack. So what happens is that muscle cells die, weaker contraction, stroke volume goes down, cardiac output decreases, and BP goes down. Next up, we have distributed shock. So there's different subcategories of distributed shock. We have anaphylactic shock, which is an allergic reaction. We have neurogenic shock, which is damage to the nervous system. And we also have septic shock, which is bacterial infection that causes sepsis. And then this causes blood vessels to vasodilate and become leaky, and this causes fluid loss from the circulation. And then last but not least, I'm going to focus on hypervolemic shock. So it's circulatory shock due to low blood volume. It occurs when extracellular fluid volume is low. This leads a decrease in water and sodium levels. About 50% of or more fluids or blood is considered to be hypovolemic. This downfall leads to decreased blood pressure and decreased cardiac output. Some examples of it, it's going to be hemorrhaging, which we talked about previously in the last lab, dehydration, burns, excessive accumulation of fluids within the interstitial space between the cells, and then we have blood loss either from trauma, motor vehicle accident, stabbing, and then a fall from a big height. And then this can lead to internal or external bleeding. Alright, so what happens during hypovolemic shock? So I chose this image because it's a pretty good visual and description of what happens in the heart in terms of preload, stroke volume, cardiac outputs, SVR. So on the left-hand side, that is the tank, right? So we have low blood volume tank. So the tank is low. Then the blood that enters the heart is called preload. So the preload decreases. And then as preload decreases, stroke volume decreases. Cardiac output decreases, and in ways in which the body tries to compensate by vasoconstricting to pull whatever blood is left back to the heart. So at this point, the heart is working hard, and this leads to an increase in SVR. The blood starts to shunt away from non-vital organs to vital organs like the heart and the brain. Essentially, organ failure will start due to not enough blood volume circulating throughout the body. And this is going to cause low blood pressure, rapid pulse, clammy skin, reduced urine output. So the simple adrenal system becomes activated by the means of baroreceptors, and then vasoconstriction occurs in the skin, digestive tract, kidneys, and muscles. Essentially, decreased blood flow through the kidneys stimulate renin secretion and activation of renin-angiotensin system. Vasoconstriction in organs raise total peripheral resistance to compensate for the drop in the blood pressure due to low blood volume, and then if there's less volume, there's a shift of fluid from tissue into the vascular system. So next up, we're going to talk about how hypovolemic shock goes hand in hand with the circulatory system and how it's damaged. So impairing the blood flow in the systemic circuit within the whole body is being impaired. This leads to organ damage due to tissues being deprived of oxygen. So we have many organs within the body while hypovolemic shock is occurring. We have organs like the brain, heart, kidneys, and lungs that are being affected. So patients experience confusion, agitation, relentlessness, and even unconsciousness. The less oxygen in the brain, the higher the risk of irreversible brain damage. The heart is actually the primary organ affected due to reduced blood flow and rich oxygen supply to the blood. Heart damage can also be caused due to overworking of the heart. Our kidney output is also decreased or complete cessation of urine production, and it's due to high sensitivity of reduced blood flow, and this also impedes organ dysfunction. We have the lungs, so fluid buildup due to low BP as well as inflammation and buildup of waste toxins in the body. So how is hypovolemia diagnosed and treated? So we have a couple of diagnostics tools to look at that. So we have medical professionals evaluating, of course, signs and symptoms and physical examinations. They do take into consideration blood tests, urine tests, complete CBC, and look at different chemistry panels. Diagnostic testings like X-ray, CT, MRI is determined to suspect any underlying causes. And then depending on the cause of hypovolemia, professionals look at different results. For instance, the patient is going into renal failure and hypovolemia is indicated. So they look out for high BUN, creatine, urine, sodium concentration, and also pH. And then depending on how that patient developed hypovolemia, different treatment plans is broken down. So of course, treating the source, so that can be involving the OR, meds for vomiting or person with diarrhea, antibiotics if the patient is presenting with any type of infection. Secondly, we have to replace the volume. So this can be done through saline or LR to maintain electrolytes, osmolarity, pH, and the buffers. And then of course also transfusing blood to make sure that you're replacing the loss of blood that person developed or that person went through, for example, stabbing. We support perfusion, right? So that's number 3. So vasopressors are good while working on the volume, and then we have hemodynamic monitoring, right? So making sure you're looking at the red blood cell panels and making sure that that's back to homeostasis. And then in some cases, we do have life support measures in which someone has to be intubated, and this is a way to protect the airway. Next up, we're going to talk about mortality rates. So when it comes to septic shock, there is a mortality rate between 40 to 50%, and cardiogenic shock has a mortality ranging between 50 to 75%, and then hypovolemic and obstructive shock usually have lower mortality rates due to timely and better treatment plan. And then for prognosis after sepsis, it takes about as little as 12 hours to cause death after shock. And then it says, according to Cleveland Clinic, life expectancy after having gone through any type of shock varies on the severity of shock and what type of shock as well too. Some people expire within a few months and up to 5 years. And then most shock survivors require placement in long-term and acute care facilities or even post-care acute centers. And then what is not really talked about, which I think should be emphasized more, is the long-term complications after shock. So your body going through a lot of trauma, right? So many people live normal lives after experiencing shock, but those who were treated rather than later in the stages at the times can suffer from insomnia, nightmares, hallucinations, panic attacks, muscle and joint pains, decreased function. This can be learning, remembering, decision making, or even concentrating, and then just organ failure and in different types of organs that, of course, were not able to be harvested during the time. So AI predicts shocks. So AI models through machine learning models are being used for early detection. AI models are being used to analyze patient data, and they include demographics, physical exams, lab results to predict likelihood of cardiogenic shock much earlier in stages. We have comprehensive meta-analysis 3.0 was used to predict a cardiogenic shock. They took into consideration age, BP, HR, O2 and blood glucose as a variable to acquire their outputs. And then it says, according to the NIH research, there is an accuracy ranging between 0.88 to 0.93 and sensitivity and specificity between 58 to 78% and 88% to 93%. So there's many AI models and learning models that are being created to aid with predictions of all shocks, but where they're starting is actually cardiogenic shock, since there's actually higher mortality rates due to congestive heart failure and then AMI. Next up, we're going to be talking about demographics. So according to National Centers for Health Statistics, sepsis occurs more among adults aged 65 and over. There were higher rates of sepsis in rural areas compared with urban areas and varied from 2000 through 2019, but generally declined over that period. So they did statistics right here. They collected some data, and they actually found that among non-Hispanic Black adults, it was actually higher compared to non-Hispanic whites, Hispanic, and non-Hispanic Asian. They also concluded in their studies that as a person past 65 years old, there were actually higher rates of shock compared to those before the age of 65. And if you look here in this graph, you actually see that those who are, of course, for sure higher than 65 years old, right here shows on the graph that 750 per 100,000 among those aged 85 and over had actually higher rates of shock compared to those who were less than 65 years old. And that concludes my presentation on shock. I know it was a bit overwhelming with all the different types of shock, but I hope you were able to understand how hypovolemia shock is diagnosed, it's treated, and just hopefully looking forward later in our nursing journey on how to treat all these various shocks. Thank you.